Good evening, friends. I'm Dr. Kattacharu Gautam Reddy. I'm a radiation oncologist. Radiation plays a very major role in treatment of cancer. So, radiation oncology is basically teamwork. So, being a radiation oncologist, I have to attribute my services for my entire team. So, I am introducing my physicist, is Mr. Senthil. These are my technologists. Physics actually converts my radiation plan into a feasible, into the mission parameters which are feasible for the delivery of radiation. These are my technologists. They basically take care of the machine and how the machine is operated. Okay. I myself am Dr. Gautam. I completed my MBBS from Sri B.M. Patil Medical College. I'm board certified by National Board of Examination in the year 2017. Then I have completed my high precision radiotherapy fellowship. I also completed my internship at Usmania Medical College, MNJ Cancer Hospital. A quick note: MNJ Cancer Hospital was actually established by Dr. Syed. Dr. Syed has been an eighth. He's a personal physician of Nizam. His son-in-law actually has started BB Cancer Hospital. The family has its legacy even starting MNJ Cancer Hospital. So we are all very proud to be a part of this great institution. My research experience includes I have been actively involved in the trials of glioma. I've been my other research includes especially contouring, comparison of CT versus MRI in busy radiotherapy departments, and also plan optimization, etc. I've been awarded an ISNO Travel Award for my paper on high-grade gliomas. With this brief introduction, I would like to go on today's topic of general awareness about cancer. Because the Facebook Live is actually meant for general people, I chose my topic in general about cancer. Then I would also specify little bit things about radiation therapy in detail. And I would also just introduce about the basic things that are happening in radiation therapy equipment. So this is my treatment planning unit. So in brief, radiation is nothing but a digital surgery. So surgeons operate on an operation table while we operate on a computerized treatment planning system. Similar to surgeons, we delineate the organs and treat it. Similar to the advancement of surgery, we have advancement in radiotherapy. With this brief introduction about radiotherapy and myself and my team, my physicists, my technologist, I'll go ahead with today's topic of general awareness of cancer. Before giving general awareness of cancer, I would just say, because unless what is learned is unlearned, what wrong that is learned is unlearned, we can't learn new things. So there are some myths about cancer. Even in 21st century, even after so many advancements, there are some myths about cancer. To debust these myths, we need to first educate the people about the myths of cancer. So I'll just talk about certain myths which patients usually talk with us. What are those myths? First thing is, cancer is a single disease. Many patients come to me and say that one of my relative has expired of cancer. So one of my relative has got this cancer, but they don't understand that there are innumerable number of cancers. From head to toe, any organ can have a cancer. It's not a single disease. Because it is not a single disease, not all cancers can be cured, not all cancers can be uncured. So this is very important. Usually patients come to me and say, sir, my grandfather had a cancer, he expired in 1 month, and they deny the treatment. So basically, not all the cancers are the same. Everyone will have their own survival advantages. Everyone will have their different modality of treatment, and sometimes one mode of treatment will be better than other mode of the treatment for particular type of cancer. So you need to remember that cancer is not a single disease. Another myth of the cancer is, cancer means death. Before the advancement of treatments, people were believing that most of the people, even it is partially true, many people who are affected with cancer would ultimately die. But death is something which no one can stop. Not only cancer, any diseases will cause death. But the time, the time of infection of the disease, and the time when the death happens. This period has been drastically changed, especially in last 2 decades. So there have been advancement in all major treatment modalities of the cancer, which includes surgery, radiation, chemotherapy, and also supportive care. Each thing has contributed in increasing the lifespan of cancer patients. Though previously cancer has told that cancer means death, that thing will not hold good in the modern era. There has been a revolutionary change in all the wings of cancer treatment: surgery, radiation, chemotherapy, and supportive care. So cancer is not death, which we need to realize and emphasize for all the people. Another one important misconception among patients, especially illiterate patients and uneducated patients who usually come to us from villages, they have a misconception that cancer is communicable. Means cancer spreads from one person to other person. This is also a very, very dangerous myth. It will stigmatize the cancer patients and cause more problems for them. No, cancer is communicable. Cancer doesn't spread from one person to other person. Cancer doesn't spread when we share our things, when we share our utensils, when we live in a home. Cancer is mostly heterogenic. It happens due to random mutations, and it is not communicable. This is one thing many of my patients will be very apprehensive for me to ask. They'll be stigmatized. There is a lot of social stigma. Yet, even this 21st century, we are seeing one side, we are seeing modern advancements in cancer. On the other side, we are seeing a lot of social stigma associated with cancer. So I want to debust this myth. And there is another very important thing. In spite of the modern developments, there are some misconceptions about the alternate treatments. Many people come to me and ask, sir, alternate treatments, which include many modalities. They ask me, sir, alternate treatments, are they better? Do they cure cancer? And many people even believe that alternate treatments are better than modern treatments. Modern medicine, which is unfortunately named as allopathy or other sufferings, is based upon evidence. So if there is some treatment modality which will offer cure for cancer, we test it on the patient, show that it's not in case of alternate treatments. So many people are misguided by these alternate treatments. After diagnosis of cancer, they move to any alternate treatments. They take the medicine. Usually the disease progresses. They come back to modern medicine for treatment, which will make it very difficult for further treatment, and it will reduce the lifespan of the patients. And patients also should be well aware about the alternate treatments, and they do not offer any cure. Another myth about cancer is cancer treatment is very costly. Most of the cancer treatments is still unaffordable to the initiatives by the government of India, initiatives of government of Telangana, and many insurance companies. Cancer treatment has been mostly covered under insurance. What problem we are facing with cancer is, by the time the patient is diagnosed of cancer, due to lack of awareness among the rural areas, lack of awareness in the basic doctors and PSC workers, the problem is most of the money that cancer patients spend is upon the diagnosis. So this can be avoided when cancer patients are specifically referred to a modern cancer hospital, even though there is a little suspicion of cancer, so that they are aware of what treatment might be and what it may be. So the suspicion of the cancer, upon the suspicion, we can diagnose the cancer, stage it properly, and cure it. What usually happens, patients, there is a long lag time between the diagnosis of the cancer and treatment of the cancer. This is causing a lot of problem. So this is another myth, that cancer treatment is costly. But actually what is happening, diagnosis of cancer has been costly. The treatment has been mostly covered with insurance. At KIMS BB Hospital, we are almost treating most of the patients freely. I think most of our team members are also aware. Most of our patients are covered under insurance. Most of the patients are covered under Aarogyasri. Most of the other patients, even though we charge, they are very nominal amount. They are they are affordable to the most of the patients. Okay, cancer treatment is not costly. Thing is, coming to a diagnosis and staging it properly usually doesn't happen at an experienced center. It usually happens at at a level where the experience of the doctors towards cancer is very less. Government is also trying to introduce many schemes to increase the awareness about the cancer. Once the awareness is increased, I think within few generations, people will directly come to cancer hospital and get treated. Another reason people will be avoiding cancer, coming to cancer hospital, is social stigma attached to other person, but that's not true. Then once these are the basic myths about cancer, I think once the basic myths are debusted and once you have been educated about the myths of the cancer and what is the truth, now we will talk about cancer in general. Then I'll introduce about radiotherapy, how the radiotherapy goes, and what are the roles of our team members, different team members, on how radiotherapy acts and what is the role of each person. Then, so there are few, I will start with, usually these are the doubts patients ask or relatives ask, and sometimes whenever we go and introduce that we are oncologists, many general public too ask us. So what are those questions usually? First thing, what is the cause of cancer? What is the cause of cancer? Many people, it is still unknown. It is still unknown. It is an research issue for generations, and scientists have even found cancer in Egyptian mummies. It's very rare. Once the Egyptian mummies are removed, they found cancerous tumors in them. The skulls which have been excavated also had some cancers. So we have divided cancers, the causes of cancer, into physical causes, chemical causes, infectious causes, and hereditary reasons. Hereditary means things which can be transmitted from one person to other person. Physical causes include repeated injury to one particular area. For example, think in case of injury by some kind of physical agent, which is repeatedly, like burns. Once a patient is burned, usually because of the injury, the impact of the injury, after centuries we get a cancer. That is called Marjorin's ulcer, which is a cancerous growth on the burned scar tissue. Similarly, chemicals. Most dangerous chemical that we come to know is right now is tobacco. Tobacco has almost 260 carcinogens. Everything can independently cause cancer. Okay, so smoking is still an it is an hazard. It has been posed as a significant public health problem. I see still many people smoke, which will cause, which is one of the major contributor of carcinoma in our country. Basically, India, most of the burdens of Indian cancers include head and neck cancer, cervical cancer, and breast cancer. In this one, head and neck cancer, which is prevalent in our country, is mainly attributable to gutka chewing and betel nut chewing and all those things. So, as an oncologist or as a general public too, we should refrain from smoking and alcohol to avoid development of any precancerous lesion. Then, other thing I just wanted to say is, once we understood what are the causes of the cancer, then we told that the major hurdle in treatment of cancer is diagnosis. So how is cancer diagnosed? Many people ask, how will I find out if I have cancer? So diagnosis of cancer is basically divided into 4 parts. One is blood tests. Some cancers can be diagnosed by doing simple blood tests. Another type of test is radiological investigations. There are X-rays, there are CT scans, there are magnetic resonance images, there are PET scans, which help us to diagnose the cancer. And then there are certain procedures like endoscopy, bronchoscopy, and colonoscopy, and visual laryngoscopy, which will also help us to diagnose the cancer. But what is the gold standard? Gold standard to say that a person has a cancer is a histopathology report. Histopathology report. What does histopathology report means? Usually, whenever there is an aberrant growth. Why do we say aberrant? Because it is not in coherence with the normal tissues. Whenever there is an aberrant growth, we take a piece of the growth, cut it into several number of pieces, and then put it under a microscope. Once we put it under a microscope, there are characteristic differentiations, characteristic differences between normal cells and tumor cells. Tumor cells nucleus is large. If there is some biology student viewing the or medical student viewing the live program, they can easily identify. Tumor cells nucleus is large. Tumor cells cell structure is altered. Tumor cell differentiation is altered, which will help us to diagnose what is cancer. Then the next thing, then we have an other kind of, then we'll talk about the treatment of cancer. What are the treatments of the cancer? Cancer treatments are basically divided into 4 types. The first thing is a surgery, which is usually called as surgical oncology. Then comes radiation oncology. Then comes medical oncology. Then comes supportive care. Supportive care usually means how do we support the patient during the treatment. Supportive care includes medicines. Supportive care includes psychological support, dealing with their mental problems, dealing with their psychological problems, their depression also. Okay. Then I would like to basically concentrate on radiation oncology treatment facilities. However, I would also introduce about other modalities. Surgical oncology basically deals with removal of the tumor, but surgery to an extent can remove a tumor, but cancer is a very notorious disease. Even though a gross amount of surgeries have been done, they usually recur. They recur because there are certain microscopic tumor cells spread over a vast number of area which will regrow and cause cancer. Then we have radiation oncology. I would like to say very proudly that I am a radiation oncologist. About cancer treatment, 50% and above is contributed by radiation oncology. The role of radiation oncology is at different levels. Some cancers are completely cured by radiation. At some cancers will have, it acts as an adjuvant treatment. Adjuvant means adding on. Suppose a surgeon performs a wonderful operation, we try that we can stop the recurrence. Some part, when we can't cure the cancer, it can also help as palliation. Palliation usually means pain relief. So at all levels of cancer treatments, there is a role of radiation. And among radiation patients, about 50% of them are curable. Generally, there is a negative vibe about radiation, that radiation causes cancer, but radiation also cures cancer. That's an irony. The thing which causes cancer also cures cancer. Then I would like to explain about radiation and radiation oncology in depth. So what all happens when a patient comes for radiation treatment? Usually patient comes to me, he is being referred by a gynecologist, for example, cervical cancer and head and neck cancers. Then in case of esophageal cancers, which are common cancers in this part of area due to spicy foods. So usually when a patient comes to us for diagnosis of the cancer, usually it will be diagnosed outside. So then the first part is staging of the cancer. We need to know what the stage the cancer is. Based upon the stage of the cancer, we can determine the treatment of the cancer. Only when we stage it properly, we can design the treatment properly, which is a very important thing that patients should remember. Staging of the cancer is a fundamental thing. It is an ABC. It's like alphabets for the treatment of cancers. Without staging the disease, we can't treat the cancer. And it is usual question for many of our patients to ask, what is the stage of the cancer? Staging of the cancer is basically divided into 4 parts. Stage 1, stage 2, stage 3, and stage 4, which also implicates the progression, the disease extent. Not all stage 1s are curable. Similarly, not all stage 4s are incurable. It depends upon the site of the cancer. Sometimes even stage 4 cancers can miraculously be cured. That's the beauty of modern medicine. But we don't generalize it. We just say that stage 1 are mostly curable, stage 4 mostly incurable. But everyone has a hope, because hope is the one which will help us to cross oceans, and help us to live. So never, never, never lose hope. Hope makes you stronger to go ahead in your life. Then now I would like to generally introduce about radiation oncology. So what happens in radiation oncology? Once we stage the disease, then as a radiation oncologist, I'll try to plan a radiation of the treatment. Planning of radiation treatment starts with immobilization of the patient. Immobilization is usually done by our what they do, because as told you earlier, radiation oncology is nothing but digital surgery. So what surgeons do in an operation table, we do it on a computer, which you can see it on the monitor here. So you can zoom it. Okay. This is how treatment goes on. So the fundamental prerequisite for treatment lasts over 25 days and 30 days. So surgeon has a choice. He is fortunate that there are anesthetists to anesthetize the patient. The patient will not move. But during radiation treatment, it will last only for the radiation, because it's surgery. Instead of a knife, we are using a small radiation beam to cut open the tumor and to replace the tumor. But surgeon has an anesthetist to restrict the movement of the tumor so that the patient lies still. Similarly, we have our technologists. They usually position the patient and immobilize the patient. By immobilization, we will restrict the patient movements to restrict the part which we intend to treatment to one particular area. So that part is not mobile. So similar to anesthetist, they will immobilize. They will position the patient so that the radiation can be delivered in a more accurate manner. So positioning is usually done by our technologists. The reason I am introducing all the people is a perfect radiation treatment doesn't include the doctor. It will include the entire team members. So if it is not positioned correctly, the radiation delivery may be compromised. That is a very important thing. Once we immobilize the patient and position the patient accurately, then we will try to the same way we treat it. Similarly, we will convert all the patients into a computerized format. For example, you can see it here. We have a computerized body. So similarly, how the patient is on a table. Similarly, we have a patient lying on a table ready for the radiation treatments. So that is another example. So equating radiation to a digital surgery. This is an example where the patient is lying down and we are sending multiple radiation beams into the patient. Okay, you can focus it so that it will be easier. I'll just zoom it. So this is patient is lying on a table. We have converted physical patient. We have converted a patient who is lying down on a couch into a digital image. Once the patient is simulated, simulation is usually done with the help of a CT scan. Once the patient is simulated, now it's our duty to arrange the beams so that one particular area is delineated. The important thing before arrangement is we have to contour. What do you mean by contour? As I told you, it is a digital surgery. As it is a digital surgery, we try to delineate the organs. So I'll just show you a simple example. Okay. So before contouring, this is a patient. So we will contour the patient. You can see it very clearly here. So we will try to delineate an organ. We will try to say what organs to be contoured, what organs need to be given radiation, what organs need to be saved from radiation. Both things are very important. And contouring is also one of the fundamental link chain in treatment of cancers. So if we other organ will get radiation. Similarly, if an organ is not delineated, that organ will not be spared from radiation. So this is the next thing is delineation. After delineation, there is something called planning. This should be mentioned very in particular. So when I'm mentioning about planning, we need to get introduced to a new member of our team. He's called a physicist. We just zoom into the physicist. Okay. So my physicist, Mr. Senthil, is a very experienced physicist. He has an experience of 10 years. So whenever we are concentrating on planning, it's a major role goes to a physicist. So what does a physicist do? The machine is similar to a computer. It will understand only one thing, 0, 1, like binary units. It will understand whether on or off. We need to make the machine understand the language of a clinician. Okay, it's like decoding the language of clinician, which our physicist will be doing in particular. So what will we identify what organ to be radiated and what organ not to be radiated? It is not understood. It cannot be understood by the machine. So physicists will actually translate our clinical knowledge into something which is understandable, which can be delivered by the machine. So that is one of the most fundamental link chain between the treatment of cancers. Then people will usually have many questions regarding radiation techniques. Some people will say 2D RT, two-dimensional radiotherapy. They say about three-dimensional radiotherapy. They say about intensity modulated radiotherapy. They say volume modulated radiotherapy. They'll say stereotactic radiosurgery. They'll say stereotactic radiotherapy. Yes, they are all different techniques of radiation. Initially, I told it's like digital surgery. These are different types of knives. Something which is sharper, something which is very sharp, and like robotic surgery, like still advanced type of surgery. What does it do? Basically, all these type of techniques, it will try to deliver more radiation to the area which needs to be having irradiated and delivers less amount of radiation to the regions which need not be irradiated, which is a very important thing. So the contribution of physics team, the contribution of physics to radiation oncology is over a period of years, they have developed machines, they have developed our planning systems in such a way that they can accurately deliver radiation to the region where clinician has delineated. So that is a major contribution from physics to the radiation oncology, in turn to the entire oncology people are entitled to the general public. So it has been an honor to work with Dr. Senthil. Then I would like to introduce about different techniques of radiotherapy. So we are just seeing on the monitor. This is one of the, here this is a 2D technique, two-dimensional radiotherapy. In two-dimensional radiotherapy, we usually have X-rays. We give radiation to the entire area which could contain the tumor. We usually don't delineate. But in case of a 3D CRT plan, we delineate the patient, which is similar to this is here. As shown in the picture, we delineate the patient. We say what region should receive the radiation, what region to not receive the radiation, but we use simple beams. Then we have an revolutionary advancement just come in the year 1990s, and it has been a rapid change. It has changed the paradigm of radiation oncology. It is intensity modulated radiotherapy. Intensity modulated radiotherapy includes, it will modulate the intensity. The beam rotates in which at such a speed around the tumor, as it is seen here. You can zoom it. As it is seen here, it will modulate the radiation in such a way that only the tumor, only the cancer, see, whatever is delineated is the cancerous region. Whatever is not delineated is a normal region. You can see how the machine is being rotated and how the MLCs in the term the micro leaflets are modulated to deliver radiation only to the region where it contains tumor, while other regions are spared. It is also a very important component. It's a very advanced treatment that is available at our hospital. Then most of the other treatments are just versions of intensity modulated radiotherapy, which will include volume modulated radiotherapy. The difference between intensity modulated radiotherapy and volume modulated radiotherapy is the time in which the radiation is being delivered. Intensity modulated radiotherapy usually takes 15 to 20 minutes. In case of complex plan, it may even take 40 minutes. But volume modulated radiotherapy, it takes the treatment which is given by intensity modulated radiotherapy over minutes can be less reduced to 2 to 5 minutes. That is an advantage. And we at KIMS BB Hospital are proud to say that it is the first in South Hyderabad to have a volume modulated arc therapy. So that's the first of its kind in south of Hyderabad. So we have a separate TPS unit, you can see, and it's a very spacious TPS unit. We are delivering most of the volume modulated arc therapy, still very affordable to the most of the patients. Then there are also other techniques like stereotactic radiosurgery, stereotactic body radiotherapy, which are other two important modalities. Even those can be delivered at KIMS BB Hospital, but they are basically more confined to very smaller tumors, which we see very rarely in our country. Stereotactic, the tumors which are likely to be cured by stereotactic radiosurgery or stereotactic body radiotherapy are usually very rare in our country because of the neglect, because of the lack of proper screening programs. Then we will also talk about some other modalities, very important modalities, which is also a very important part of cancer, called brachytherapy. In case of external beam radiation therapy, most of the radiation is delivered from outside the body. But in case of brachytherapy, the radiation is delivered inside the body. I'll just show you one brachytherapy. Dr. Senthil usually plans brachytherapy for us. We'll also show how a brachytherapy is planned. So in this one, see, the previous one had radiation coming from the outside, while this one has radiation coming from the inside. So the sources are sent inside the body, and then radiation is delivered and the sources come back. So this is one of the plan that we have generated yesterday. Here the radiation is sent inside, the sources deliver radiation, and it is planned by the computer, and the sources come out. This is also another type of radiation therapy. Brachytherapy is basically useful in treating of cervical cancer, endometrial cancer, and also some cases head and neck cancers. So these are some of the basic, I think it's a basic radiation oncology technique. Then I should also mention, many patients ask me, they're very afraid of radiation because radiation has passed through many stages. Initially, we were treating with very crude X-rays. They would cause a lot of skin reactions. And to mention, many people come to us and say it is as current therapy. They say it as current petatum in Telugu. There are many Telugu people seeing current treatment, shock treatment, they'll say. That's a very vague term. That is actually, it's like insulting a radiation oncologist. So why did the term come? Why did the term called current therapy or shock therapy come? The reason is, previously we were using very crude methods of radiation. So the skin would be charred, the skin would be blackened, similar to how the patient gets a shock, electric shock. But those kinds of treatments or those kind of reactions are very rare these days. Because of the advancement of the machine, we do not get any skin reactions. Most of the radiation dose is delivered directly to the tumor and the nodal regions rather than the skin. That's the reason that I think my small little words would try to change the mindset of the people, that it is not called as a shock treatment. Instead, we can use a very fashionable term like light treatment or photo treatment. So where it will signify the decrease the severity of the disease, then decrease severity of the treatment. I have also introduced about brachytherapy. So usually another thing they usually ask, how long is the radiation treatment? We will have radiation treatment which will span over 30 days from Monday to Friday. Saturday and Sunday usually will be used for mission QA and mission quality assurance, which is very well done at our institution. So in quality assurance, we usually check whether the treatment is being delivered to the patient or not. It is usually done on the Saturdays. So it is usually in over 25 to 30 sittings. Sometimes we may extend to 40 sittings. So people are also afraid to come over long periods, but you need not be so apprehensive about radiation therapy. It will last only for 5 minutes. The entire thing is already planned. You just need to be staying still on the machine, be treated and go. You will not have any further complications. Another most important thing about radiation treatment, or the query about radiation treatment, is, are there any side effects of radiation treatment? So always, whenever there is something giving to you which can cure cancer, it can also cause some side effects. The usual side effects we see is skin reactions. Skin reactions. Why do we get skin reactions? It is because it was very prevalent in olden days, which caused the term current therapy or shock therapy. Why do we get skin reactions? Because radiation treatment delivers radiation into the organs. Sometimes what happens, most of the radiation is delivered onto the skin. So skin will get more amount of radiation, so it may cause radiation dermatitis, which will look as some skin wounds. But those kind of severe reactions are very rare these days because of the advancement of the technology. Then after radiation treatment, other modalities of cancer treatments include chemotherapy, which our medical oncologist friend will be explaining you in the further live video. So then another important thing is follow-up. Many patients, we say they get cured of radiation therapy, then they don't meet us. They go into the air. So how important is follow-up? Cancer is notorious disease. It can recur. The good thing is, even though it recurs, we can cure it. But as said, the recurrence should be diagnosed earlier as possible. So after treatment, we usually ask the patients to come on follow-up, initially for every 3 months, then for 4 months, then after we'll ask them to come for 6 months, then for 1 year. Usually we will follow up a cancer patient for a total period of 1 year. And I would like to ask if you have any doubts, questions about cancers. I would like to invite you from the questions. Okay, so few questions. We got few questions from the live. First question would be, as I have already explained, as I expected this question, what is cancer? Basic question from most of our people who are on the live. What is cancer? Cancer is nothing but abnormal growth of the cells, which is not under control of the body. Many cells grow in our body, okay? But how is cancer different from the growths? Our hands grow, babies grow, right? Our hair grows, our nails grow. But how growth of hairs, nails, and our body is different from growth of a cancer? These are all controlled. They are controlled by our body. They are controlled by our mind. But cancer is something which can't be controlled. It's uncontrolled growth of cells. This uncontrolled growth of cells is called cancer. I got another question which I had already explained in my previous seminar. What are the causes of the cancer? Why does cancer occur? It's still a dogma. Many people all over the world are still fighting with this dogma. It's an unended, never-ending question. There is no one single cause of cancer. There is no one single solution for cancer. As I said, there are many physical agents, chemical agents. There are many infectious agents. Sometimes some infections also cause cancers. Many things, chemical things like cigarette smoking, taking alcohol, and getting exposed to other things. Then other question I got is incidence of cancer raising these days? Right? Many people think incidence of cancer is raising. Yes, we have altered our course of life from a natural way to artificial way. Most of the foods we take are adulterated. The air we breathe is polluted. Okay, the water we drink is contaminated. We are not living the natural course of a person. It is both boon and a bane. There were no cell phones previously. Now we have a lot of cell phones in our hands. It has enhanced our capabilities, but at the same time, probably because of natural balance that should be created, it has also increased, probably due to contamination by various things. The incidence of cancer has been increased. But more than incidence, due to advancement and the reach of many public healthcare facilities, diagnosis of cancer also has been increased these days. Many people are going to labs, they are getting diagnosed. So many cancers are being diagnosed. This diagnosis of the cancer is also a reason why it appears as if the incidence of cancer is increased. So another question is, can it be caused by a bacteria? Can it be caused by a germ? Can be caused by any infectious agents? Yes, there are some infectious agents which can cause cancer, but these infections are not usually communicable. The next question I get is, can smoking cause cancer? Definitely, we discussed earlier. Smoking, tobacco has about 260 carcinogens which are proved to be carcinogenic. There's definitely, there are many reasons that it may be cancer. Other thing is how do you come to know that one has cancer? I said earlier, the diagnosis of cancer includes blood tests, histopathology, radiology, and certain procedures like endoscopy, colonoscopy, etc. So few people are asking, yes, this is some question. This is Mr. Hari Prasad. He asked me, doctor, daily routine and habits in modern living gives more impact or exposed to cancer? If yes, can you elaborate about more and preventive measures we have to adopt? I was about to say the same thing. How do you prevent? The question includes two things. Modern living is it suscepting people to cancer? Yes, due to contamination of air, contamination of water, contamination of food, it is suscepting us to more amount of unknown chemical things which may be carcinogenic or not. The second thing is, can we prevent the cancer? Prevention of the cancer is also a subject of debate since many days. There are few measures now to detect cancer in early stage. Prevention of cancer has not, there is no one single agent, as said, because it is not a single disease to be prevented. Each cancer has its own etiology, each cancer has its own cause, so there is no one single tablet, one single modality to treat cancer. And there are many advertisements we can see in Facebook, in other regions, some pamphlets that preventing cancer, but that is not possible at right region. We are trying to avoid certain cancers like cervical cancer by giving vaccinations, preventing the infection, which means HPV infection, which will further cause cancer. However, the vaccinations have been recently introduced. The long-term data of the vaccines has been not still robust, but still we'll hope for the best due to technological advancement. One day there will be a day where we are not relevant anymore. We are not unhappy for that. We have seen sufferings of the patients. We know what cancer is. We are very empathetic human beings. We wish we are not there. We don't want to be there. We dream for the cancer. We will dream for that. Then another question is there any methods to protect ourselves from the cancer? Santosh has asked me a question. Many people are very fancied about film stars these days because many film stars are dying of cancer. They are getting infected. They are getting diagnosed of cancer. So we are getting a lot of attention these days because film stars are getting cancers. So as told earlier, this is a question which got repeated. The first myth about cancer, what did I say? It is a single disease, right? Cancer is not a single disease. Sonali Bindre has got cancer. It's a very tricky, very catchy headline, but it is not a single disease. I can't say what is the cancer by just saying, by using the term cancer. Cancer has multiple, cancer can affect multiple organs. Cancer can be in many stages, very specific. I'll say an example. For example, I've just seen in my outpatient wing cervical cancer, okay, which is very common cancer, but that is still a very vague term. The correct term is carcinoma cervix stage 3B. So we have termed this cancer, we have staged the cancer. So these are two components, very two important components of cancer. Okay. Then we have other questions from other people saying that how does a doctor confirm whether we have cancer or not? I told you earlier, based upon diagnostic tests, procedures, and other things. Then we usually hear, what is a mammogram? Another question. Mammogram also uses X-rays, which is radiation, but they have reduced energy, by which the harmful effects of radiation are not known. As I told earlier, most of the cancers are curable, but they need to be diagnosed earlier. Screening, mammograms is a screening modality. What screening will detect the cancer in a small stage. So mammogram helps us to diagnose the cancer. Mammogram is useful to diagnose breast cancers. Then another frequently asked question, pap smear. Usually in most of the gynecological checkups, they include pap smear. What is a pap smear? Pap smear is actually invented by Papillonicu. He's a pathologist. So what he found out is, before onset of cancer, this is specifically in terms of cervical cancer, before onset of the cancer itself, there will be some shedding of cancer cells. So these, if we can identify these shed cancer cells by some kind of test, we can diagnose the cancer even before it becomes a cancer state. So we can diagnose precancerous lesions. Precancers are the lesions which might be developing into cancers. So that is another test which is useful for screening. Then there is another cancer. There is one common question. I think I will be bombarded with such kind of questions everywhere. Can cancer be completely cured? Can any disease be cured? It's a very diplomatic answer. Yes, early stage cancers can be cured completely when the patient is properly staged and when the patient is properly treated and when patient is properly followed up. Early stage cancers. Few of them, even in late stages, will be cured. But however, as it is not a single disease, we can't specify that every cancer can be cured or every cancer cannot be uncured. It again depends upon the pathology of the disease. It again depends upon the stage of the disease. Then this is a question which is very much related to me as a radiation oncologist. How does radiation therapy work, or what is radiotherapy? How can radiation which can cause cancers can also cure cancers? Radiation therapy deposits energy in a very discrete manner. In case of cancer, it will try to destroy the cancer cells and spare the normal cells. Why normal cells can be spared? Because normal cells can repair themselves, while cancer cells cannot be repaired themselves. With the advancement of technology, as I showed you, we can deliver radiation only to those particular areas which have a probability of having cancer, while other areas can be spared. Okay, that is another very important question I usually find. Another question I got is, what are different kinds of radiation therapy? So as I told, there are two basic different kinds. One is external beam radiation, another is brachytherapy. External beam radiation include different types of delivery. It's the same technique, but types of delivery of radiation are different. Different types of radiation delivery techniques include two-dimensional radiotherapy, three-dimensional radiotherapy, intensity modulated radiotherapy, volume modulated arc therapy, stereotactic radiosurgery, stereotactic radiotherapy, stereotactic body radiotherapy. These are different kinds of radiotherapy, different kinds of external beam radiotherapy. Then we have different brachytherapy. Brachytherapy usually includes implanting the radiation sources into the body. And there are also different types of brachytherapy techniques. And I should mention about Dr. Nisar Syed. He's also founder of this hospital. He's a pioneer in making many brachytherapy instruments. I say today, if cervical cancer has been termed as a curable disease, there is a contribution of Dr. Nisar Syed in curing of cancers. That is another bite we just wanted to say about our hospital. Then we have a question from Neelima. What are the advanced diagnosed equipment you have? Is all types of cancers can be diagnosed at your hospital? Because nowadays every hospital uses the terms bombard, we treat, cure all types of cancers. I told you, there is no, yes, we treat all type of cancers. We have all the equipment required to diagnose the cancer. Okay. Yes, most of the cancers are diagnosed at our hospitals. We will never say we will never say that we will cure all the cancers, but we will say we will help the patients the best. We will support them. I should also mention you one important thing. There are two types of cancer hospitals. One are dedicated cancer hospitals. Another thing, general hospitals which have a cancer wing. So usually you might be in dilemma, which are better to get cured for cancers. Ours is a dedicated cancer hospital. So everyone in general hospital, what will happen? There will be a lot of patients, and in those patients there will be cancer patients. So they may give a first priority, they may not give first priority. I'm not generalizing it. But in a cancer hospital, everyone, each and every person is very passionate about the patient. We treat only cancer patients. So for us, every cancer patient is curable. We will try to offer our best services to cancer patients. So I think that may answer to a certain extent your question. But as far as KIMS BB concerned, we have all the equipment to diagnose cancer, all equipment to cure the cancer, and as told, it has been out of emotion that this cancer hospital has been formed. Dr. Nisar's, the pioneer in radiotherapy instruments, mother's name is BB. Out of that emotion, he has established this hospital, and it is the first private cancer hospital in South India. It's the first private cancer hospital in South India, especially in Andhra Pradesh. So we have been into the field before other people have thought of curing cancer. So at our places, it is more about patient satisfaction. Utmost importance is given to patient satisfaction, and because we don't treat any general patients, we have only cancer patients. So cancer patients will be our first priority, and all our resources are more directed towards treating cancer patients. So every patient here is infected of cancer. So all our resources, whatever resources we have in this hospital, is directed towards treating cancer. This is something which I would like to emphasize. One of the questions. Okay, so we got another question by. I would not like to comment on this one because we will not comment on any other thing. We know what we are doing. It's a question. I'll just read it. Had personal experience like one of the top hospitals in Hyderabad itself failed to diagnose cancer, which later led to very critical situation. What expertise the hospital is? I don't think that it is appropriate to answer to this question because we will just say about what's happening at our institution. Okay. Then another question is radiotherapy safe? As we answered it, we questioned it ourselves. We answered it many times. Some people will get cancer out of radiation. Some people will be cured out of radiation. So I will say you in brief history how radiation instruments have actually come in place. World War II has invented two things. One thing is nuclear weapons. Other thing is to fuel those nuclear weapons, it has also created linear accelerators. So I would definitely say today, the number of people died in World War II is high, but number of people cured out of cancer due to invention of linear accelerator is higher than the people who were killed in World War II. So everything it is a double-edged sword. This invention, when used properly, can cure cancer. When used negligently, can also cause cancer. This is another common question I get. How should I take care of myself during radiation therapy? So basically, radiation therapy is characterized by skin reactions. So cleanliness, maintaining hygienic skin, washing it with warm water, lukewarm water, and seeing that there is no infection over the skin can reduce the amount of skin reactions that are present. I think, if any more questions? Okay. Now I've introduced about the hospital earlier. I would still like to further elaborate about the services and the treatment that is going on at our hospital. The big history we can see further only when we stand upon the shoulders of giants. It's a very important message I learned from many people. It was the thing which was told by Newton. Many people were praising Newton. Then he told the same thing. You can see further when we stand upon the shoulders of the giants. So it is my honor to remember the legacy of the hospital. It has a rich legacy. I don't think that any other cancer hospital has such a long history of association with treatment of this dreadful disease. It It has been called Emperor of all melodies. Melody means suffering. It has been Emperor of sufferings. And how the hospital is associated with treating or defeating this Emperor of all melodies, the cancer. So, Dr. Syed is a personal physician of the Nizam, 8th Nizam of Hyderabad. He has been instrumental in starting first cancer hospital in South India. It is the MNJ Cancer Hospital, Mahdi Nawab Chek. It is now being converted into a government cancer hospital. He started the first cancer hospital in Hyderabad. It's a government cancer hospital. Then there is Dr. Nisar Syed. He has started the first private cancer hospital in South India. It's called BB Hospital. He was moved by his the death of his mother BB, so he established a cancer hospital on her name. It is BB Cancer Hospital. It been started in 1984. So there are a lot of Dr. Nisar Syed has been instrumental in discovering many cancer treatments, brachytherapy equipment, which has revolutionized the way we treat cancer. I would definitely say that all the patients being cured of cervical cancer do hold some gratitude to Dr. Nisar. I'm very proud to say that this hospital which I am associated with has been associated with Dr. Nisar. Then I would also like to say you some few things, that we were the one who bought linear accelerator. As I told you earlier, previously it was called as current treatment because the skin was scarred. We were the first one we brought linear accelerator, a modern radiotherapy machine which will reduce the amount of skin reactions in patients. It has been still there, it's working still. It was bought in 1995. Now we have upgraded our machine to treat many other advanced techniques like intensity modulated radiotherapy, stereotactic radiotherapy, stereotactic radiosurgery, and in volume modulated arc therapy. I would also like to say a special note on Kerala Institute of Medical Sciences. Kerala Institute of Medical Sciences is a multinational conglomerate. It has branches all over the Kerala. It's a very reputed hospital in Kerala. It has branches in Dubai and almost all the Gulf countries. So it has taken up BB Cancer Hospital. As I said earlier, it is a blend. It is a blend of both cure and care and compassion. We treat with all our dedication. It's not only the doctor. Everyone in this both is moved by the compassion, courtesy, and care of the hospital management systems, and they have not restricted us in delivering our service to the satisfaction of ourselves. They have never restricted us. I would like to say that I would now like to say that any patient can walk into this hospital without a penny and get cured and go out of the hospital. I would like to say it very proudly. I've been associated with the hospital. I would like to say most of the patients we cater are very poor people, downtrodden. In a way, we are fulfilling the dream of the founder of the hospitals. However, this will never compromise the quality of the care that we are delivering in the hospital. I would say that we are delivering the most advanced radiation therapy with the utmost care in this hospital. Then there is a simple question: why choose KIMS BB? I think what all I told is self-explanatory. The legacy will prove us whether we are right or wrong. But I would say it's passion towards oncology. It's a passion towards patients. It's our commitment towards patient service which will make you to choose KIMS BB Cancer Hospital. Regarding the people and equipment, we are equipped with all types of cancer modalities. We have a special surgical wing which has surgical oncologist. To mention Dr. Uday Chavan, is a very reputed surgical oncologist. It has been a wonderful experience to work with him. Dr. Pradeep. We have a medical oncologist too. We have a radiation oncologist. We have a separate palliative care unit where we treat the patients in the end of their life. We have a wonderful team of radiation oncology, my physicist, Dr. Senthil, and we have a wonderful team of radiation technologists. As I told them, they are also an important part of radiation treatment. Then we have also we have many other specialties coming to the hospital and contributing to the patient care. Regarding another thing, I have just got a question: cost of treatment. As I told here, most of the patients are covered by government and public sector insurance. I would say that we are proud to say that we can treat any patient penniless, but not at the cost of low quality. We'll never do that. At most, international standards and guidelines are being provided, and we can also provide low, affordable, quality healthcare at this hospital. And regarding medical equipment, I had just got a question. Yes, we have Rapid Arc. Rapid Arc is a machine name. So basically, it's a technology name of a technology. So it is in term for volume modulated arc therapy. It is basically an advancement over intensity modulated radiotherapy, which can deliver radiation within few minutes. An intensity modulated radiotherapy takes time over 20 to 30 minutes. Volume modulated arc therapy can reduce the time of radiation delivery to 2 to 3 minutes. Then if there are any more questions, I would like to thank all my team. I would like to thank the entire hospital for providing me this opportunity to educate and to say about cancer treatment and its awareness. Very grateful to you. Thank you.